It's being called a national epidemic, and it's hard to avoid the headlines about the country's addiction to heroin and opioids, and it is just starting to hit our area very hard.
With the help of an undercover drug officer, Local News 8's Dennis Valera has found this drug is hitting anyone and everyone. He tells us how you can make sure you and your loved ones are not next.
It doesn't discriminate. It gets anyone and everyone.
It's how one officer in our region describes the power of heroin and other opiate drugs. For his safety, we'll call him John Smith. He says the rise of these drugs happened the last couple of years, and the addictions start when people need help.
For many people, it started out innocently for a sports injury or some type of ailment, and ultimately ended up as addiction.
And everyone is vulnerable.
It's the soccer mom, it's the professional, it's the student athlete, and unfortunately, it's the mom that's having a baby.
In Pocatello, there were 302 drug charges in 2014. It took a little dip in 2015 with 262 charges. Bannock County was different. They filed 292 drug felonies in 2014 and then filed 415 in 2015. In Idaho Falls, police recorded 365 charges in 2014, going up to 486 in 2015. Bonneville County also saw an increase from 221 in 2014 to 292 drug felonies in 2015.
What's the most surprising thing that you've seen be a cause of this drug?
Heroin, opium-based accidental overdoses is beyond my recognition as a policeman. It's unbelievable.
An ER doctor here at Port Neuf Medical Center has seen this firsthand. He agrees it's a tougher battle than the area's history with meth.
Meth is terrible, but it doesn't cause the respiratory depression that the narcotics do. And that's really why individuals, when they overdose, they stop breathing.
To help combat the problem, the CDC issued new opiate prescription guidelines in March. They promote using non-opioid drugs and prescribing low doses of opiates if necessary.
So these new CDC guidelines, were they needed?
Yeah, they're way over past due.
Dr. Holly Zoe has been practicing pain management for nearly a decade in Idaho. For her, the guidelines shed a light to the problem, which she already tries to prevent with her patients.
I always approach with a stepwise approach, meaning non-invasive ways to treat patients, not dependent on opiates, because it's the last method I prefer to use.
They might have very erratic mood swings. 1 minute they're fine, the next minute they're not fine. It could be that you're talking to them and they start having a stupor of thought.
Those are some warning signs of users, according to counselor Brooke Hurt. While the topic can be hard to bring up with loved ones, she says it's never too early to talk about.
We are going to want to be a little bit more educational and a little bit more confrontational. Maybe talking a little bit more about the effects of the drugs, things that could happen to them if they were to use too many.
Officer Smith recommends trying to avoid it altogether.
Big driving force is prevention, never putting yourself into a situation that you potentially can become addicted to such a drug.
We have a bigger list of the warning signs on our website. When wanting to have that conversation with someone you think is using, try being a little bit indirect. For example, you might say, "I'm concerned you've been acting different. Is there anything I can help you with?" We've also mapped out some resources in our region.
And I understand, we can't emphasize enough that this is a bigger problem than most people realize,
Yeah.
and it is so addictive and so dangerous.
Yeah.
And fairly inexpensive. That's the other problem.
But at least the medical field has gotten wind of it. They're starting to figure it
Yeah.
out. So maybe the pendulum will start swinging,
Right.
with more education.